Good day, everyone, and welcome to my lecture, Introduction to Anatomy and Physiology. I am Dr. Geraldine Biran, and I will be the one lecturing this topic. Okay, these are my intended learning outcomes: to define anatomy and physiology, to discuss different divisions of anatomy and physiology, levels of structural organization of the human body, discuss the major organs and functions of each organ system. We will also be describing the normal anatomical position, the anatomical planes and sections of the body, identify the four quadrants and the 9 regions of the abdomen. Okay. We will also be describing terminologies which will be used in anatomy and for the entire semester. I'll also be describing two major body cavities, their subdivisions, and membranes. Also, we will be describing the general nature of metabolism, and we will be discussing the homeostasis. Okay, so let's define some terms. Anatomy, when you say anatomy, this is the science of structure and the relationships among the structures. Okay, and when we say physiology, it's the science of the body function. That is how the body parts function. The structure of a part often determines how it will function. So basically, when you say anatomy, it's the structure. When we say physiology, it's its function. Okay, what else? There are actually levels of studying anatomy. First would be gross anatomy. These are the study of large structures. No, they are easily observable, meaning they can be seen by the naked eye. You can touch it, you can feel it, you can describe it by easily. Um, you can easily understand it by all your senses. Okay. When we say in gross anatomy, um, this is we study gross anatomy by when we study medicine. Okay, there is this two division: gross anatomy and microscopic human structural anatomy. The gross anatomy is actually the anatomy and physiology in medical technology, while the next one is the microscopic anatomy. This is equivalent to human histology, and that human histology will be encounter that on the next level on your second year of your medical laboratory science course. Okay, when we say histology or microscopic anatomy, we deal with the study of very small structure and can only be viewed with a microscope. Okay, so as a medical laboratory scientist, we deal a lot with microscope. So this is actually one of my favorite subject of anatomy, histology. Okay, there's also a level of study in anatomy. We have the neuroanatomy. Okay, when we say neuroanatomy, this is also known as our neural human structural biology. It's the neural HSB, and we are under the Department of Human Structural Biology, meaning we teach different levels of anatomy. Okay, what do we study in neuroanatomy? It's the normal gross and microscopic features and the development of the nervous system. So meaning the brain, the spinal cord can be seen using gross anatomy, but on its microscopic or histologic level, with the aid of a microscope, we can also study neuroanatomy histologically, meaning with the aid of microscope. When you say grossly, we study the brain, no, in its whole anatomy. Okay, what else? There is another level of studying anatomy. This is your embryology, or we call this as the developmental human structural biology. So what do we study here in embryology? The origin and the development of the human body from fertilization of the ovum to the extrauterine life, meaning from when you are still in the process of developing a human body, no, fertilizing the ovum until you were born in this life. Okay, we are actually studying the embryology, how these organs originated, developed through time. So this is what you call your developmental human structural biology, or we know as your embryology. Okay. Okay, after discussing the different levels of studying anatomy, we now go to the structural organization. Now, as we all know, no, I'll use this cursor. We will be starting with the chemical level. No, these are the atoms combining to form molecules. Okay. From then on, it will be in the cellular level, which is made up of different molecules. So this is an example of a cell. It's a smooth muscle cell. After which, from the cellular level, it will go down to the tissue level. And when we say tissue level, the tissue now consists of a similar types of cells. So this one is a smooth muscle tissue. Why? Because it is composed of different, no, or similar types of cell, or more than one cell, but of similar type. So this is now called your smooth muscle tissue. Okay. Now from the tissue level, we'll go now to the organ level. So when we say organ level, the organs are made up of different types of tissue, now which will be discussed in this session. Okay. The first is the epithelial tissue. And then if this is the smooth muscle, so it is a smooth muscle tissue. What covers the muscle tissue is actually a connective tissue. So this will be further discussed in a while. Okay. Now from the organ level, which is made up of different types of tissue, we go now to the different organ system level. So when you say organ system level, this consists of a different organs that will work together closely. Example of which is a cardiovascular system. No, it works hand in hand in delivering blood from different types of different organs, including the muscle. Okay. And lastly, the organismal level. The human organisms are made up of so many organ systems, and this will make up the human body. Okay, so those are the level of structural organization. Okay, after delivering to you the different levels of studying anatomy, the structural organization, let's go now to the divisions of anatomy. Okay, when you say divisions of anatomy, it's not just purely structure. So as I mentioned, when you say anatomy and physiology, they come hand in hand. If we will be able to study the structure, we should know the functions of that, right? So in the divisions of anatomy, we have the different types of physiology. Okay, we have the cell physiology, and neurophysiology, pathophysiology, meaning if you have this normal function physiology, we any alteration of its function will produce a pathology. So we will be describing the pathophysiology. For the pathophysiology, we usually encounter this if you have a medical problem. May sakit ka. Okay, if you have a medical condition, for example, fever, no? You have infection. The normal function of our body is physiology, right? But if you have in an infection, no, it alters the homeostasis, it alters the normal function of our body, it now becomes a pathology. Now we are actually discussing, or we are actually learning about physiology pa at this level, first year anatomy or first year medical laboratory science student. But when we go on a second year, on a third year level, especially in medicine, we have to know the pathophysiology, or the pathology of that physiologic function. And we call it the pathophysiology. Okay. What else? We can also be describing a cardiovascular physiology, a respiratory physiology, renal physiology, study of the normal function of the kidneys, endocrinology. No? When you say endocrinology, it's the study of the different endocrine organs. And when you say endocrine organs, it secretes different hormones. Okay. And that hormones can only be found in the blood. So these are measurable by collecting blood sample in the laboratory. And also exercise physiology. Actually, the exercise physiology is the combination of not just cardiovascular and respiratory, but also the whole human body. Okay. Okay, so let's talk about the different Okay, the different organ systems. Now, this is just an overview of the whole semester. But at this session, after completing this session, you have to memorize, or you have to know the different functions of each organ system. Now we'll start with the integumentary system. No, when we say integument, this actually mean skin. Okay? It forms the external body covering. As we all know, it protects deeper tissue from injury, especially if you have traumatic injury. No, unang-una muna yung makakasangga is the skin, not the muscle or the bone itself. Also, the integumentary system, it synthesizes the vitamin D. No, that's why sunlight exposure, but not all the time. No, sunlight exposure from 7 o'clock to 9 o'clock a.m. and 5 o'clock onwards. No, dito yung medyo mababa ang UV rays natin. Diyan pwedeng ma-expose at diyan makakuha ng good amount of vitamin D. But the skin itself, it synthesizes vitamin D to become active. No, it will be activated and it will be used for some functions of vitamin D. What else? As you all know, integumentary system, or the skin, it has cutaneous nerve receptors, pain nerve endings, light touch, no, pressure. This can all be a function of your integumentary system. Okay. Next system is the skeletal system. So basically, when you say skeletal system, its function is to protect and support the body organs. Example, the brain, it is actually being supported by the skeletal system. We all know this as the skull. The heart and the lungs, no, it is actually protected. And it is supported by your rib cage, okay, your thoracic cage. The bones itself, or the skeletal system, it provides muscular attachment for movement. So without the muscle, no, we cannot actually move. No, the skeletal system is just a muscular attachment, okay, for us to move. The skeletal system also is the site of blood cell formation. The bone marrow is actually a site of hemopoiesis, or blood cell formation. Hematopoiesis. This will be all be learned in histology. Yeah? And it stores minerals, especially calcium, phosphorus, and different electrolytes, different minerals. That's why we have to take good care of our bone by drinking milk, which is actually rich in calcium, and other calcium supplement whenever we age, especially for the geriatric population or elderly population. Diyan na nagkakaroon ng osteoarthritis. That's why they have to be supplemented with vitamin D and a similar effect to that. All right, muscular system. When we say muscular system, it allows locomotion or movement. It actually also maintains posture, and it produces heat. Okay. For me, personally, this is actually one of the hardest topic in anatomy and physiology, because it's not just purely identification of its muscle. No, we have to identify the origin, the insertion, its action, etc. So it's kind of one of the hardest topic, but it's actually more interesting to note. It's one of the most hardest, but one of my favorite subjects. Okay, of the anatomy and physiology, muscular system. Okay, obviously, no, from the drawing on your right side of the screen, the nervous system is composed of the brain and the spinal cord. Its function is for control system, fast-acting control system, responding to internal external change, and it activates muscle and glands of the whole body. So it all brings down to the brain, which is the command center of the human body. Okay, endocrine. As mentioned a while ago, when we say endocrine system, it secretes regulatory hormones. No, and hormones are can only be found in our blood. So where does it go? It goes to the target organs. So endocrine system in general uh, can be used in the function or in the regulatory function of growth, reproduction, uh, body metabolism. What else? Controlling the blood sugar and controlling its sleep cycle. Now, this will be all discussed. I think this is the last topic in anatomy and physiology, and I will be discussing that to you. But in general, for this session, all you need to know is that endocrine system controls growth, reproduction, metabolism through regulatory hormones. Okay, cardiovascular. From the word itself, cardio meaning heart, no, and vascular meaning blood vessels or transport system. It transports the materials in the body via blood pumping from by the heart. So it transports oxygen, carbon dioxide, nutrients, waste products. Uh, what else? So if that pumping system altered, there will become a pathophysiology of the cardiovascular. So this will be discussed further in the cardiovascular system, I think in midterms. Okay, just like in the cardiovascular, lymphatic system also uses lymphatic vessels. So if you look at the cardiovascular system, it uses blood vessels, right? So it contains blood, either an oxygenated or unoxygenated blood. But in the lymphatic system, it also uses vessels. We call it lymphatic vessels, and it contains the lymph. Now, when you say lymph, they are very much involved in the immunity, especially now that it's pandemic. So lymphatic system is involved in immune system also. It returns fluid to its blood vessels and it disposes of debris. Okay, what else? The lymphatic system. Okay, after the lymphatic system, it's the respiratory system. Now, the main function of the respiratory system is to keeping blood being supplied with much oxygen needed for the entire body. Okay, it also removes the carbon dioxide in exchange of oxygen. And respiratory system, as you all know, it involves the lungs, no, the trachea, all the organs in the respiratory tract, and obviously, no, with this pandemic, it affects the respiratory system. And right now, this weather, it's common to have an upper or lower respiratory tract infection. It's caused by viral or bacterial infection. Okay, so must know yan that the respiratory system, especially this one, that's the main function. You are supplied with oxygen, it removes carbon dioxide. All right, digestive system. Digestive system from the word itself, digest or digestion. It breaks down food. It allows for nutrient absorption into the food and it eliminates also indigestible material. So as you can see in this picture, from the oral cavity, it goes down to the esophagus. From the oral cavity pala, meron ng digestion. So using a saliva. In our saliva, we have salivary amylase. No, it's an enzyme that digests certain amount of macromolecule. So from the oral cavity, it will go down to the esophagus, to the stomach, where some of the protein, carbohydrates, and fat digestion also happens. And from the stomach, it goes to the small intestine, large intestine, rectum, and anus. So that anus will eliminate some of the indigestible material, which is mostly water and some waste products. Urinary system. It eliminates now nitrogenous waste products. So it also maintains acid-base balance. It regulates the materials such as your water, your electrolytes. Urinary system, from this picture on your right side of the screen, are the organs will be involved are your kidneys, your ureters, your urinary bladder, and the urethra. Guys, we have two kidneys, two ureters, and one urinary bladder, and also one urethra. Other pathologic no, pathologic or abnormal findings in the urinary system, not just the UTI, but also nowadays because of these patients na not adherent to their diet, no? Medyo mataas ang salt content nila, wala masyadong water, nagkakaroon na silang kidney stone. And if you would look closely, this kidney stone here will be will go down to the ureter, and this is the one of the most painful symptom na may kidney stone at the ER. Okay? Reproductive system, meaning production of offspring, and it involves your male and female reproductive organs. Okay, this will be topic in your finals. All right, so after discussing or giving you a rundown or overview of the different organ system, let's go now to the language of anatomy. So this is actually very important because we will be using, not just me, I'm a lecturer, no, I also will be handling laboratory. The laboratory professors, no, before they teach you different organ system, we have to know exactly some of the anatomical terms or special terminology to prevent us from misunderstanding the anatomy per se. Okay, exact terms are used for the following: position, direction, regions, and the structures. Okay, so this will be introduced to you by yours truly. Okay, let's first discuss the anatomical position. Okay, what do you mean exactly when we say you are anatomically correct or you are positioned anatomically? So let's discuss the anatomical position. The person is, number one, is standing erect. Okay, head, eyes, toes directed forward, not sideward. Okay, they are directed forward. The heels and the toes all together, they are flat on the ground, and the upper limbs hanging by the sides with the palms facing forward. Okay, with the palms facing forward. That is the anatomical position. Trust me, in every examination, lumalabas ang anatomical position. Can you identify which of the following is the anatomical position? Okay, so you have to know this by heart. Next is the anatomical planes and sections. So this is actually very important in describing the human anatomy. No? Let's discuss first the median or the mid-sagittal plane. When you say median or mid-sagittal plane, it equal right and left. Okay, only one medial plane. So when you divide the human body, equal ang right at ang left. So meaning this is the median mid-sagittal plane. Okay, when you say sagittal section, no, it is an equal right and left. Meaning, for example, we can have the sagittal cut here, but you have left and right, but it's not equal. Okay, you can have a sagittal cut here, no, but you have an unequal right and left. But if you want to divide the plane or the body equally right and equally left, you call this median or mid-sagittal. Okay, but if it is unequal, it is called your sagittal plane. Okay, next, your coronal or frontal plane, equal or unequal front and back. So meaning, this is my front, this is my back. If you want to do a coronal or frontal cut or plane, we have to cut equal or unequal front and back. Okay, so these are the most commonly asked plane in the examination. So you have to note the median or the mid-sagittal, the sagittal, and the coronal or frontal plane. There. So mid-sagittal or median, no, equal right and left. Frontal or coronal, dividing the front and the back. And we also have the transverse plane. We divide the body to upper and lower area. Okay, upper, lower, what are the other terms? Superior and inferior area. So these are the most commonly asked planes or body planes in the human body. Okay, so let me just introduce to you to some directional terms or orientation terms. So are you ready? So let's start with this term. superior, okay, or cranial or cephalon. By definition, this is toward the head and or upper part of a structure or the body, or simply above. Okay? Anything that is above, we call it superior. For example, the forehead is superior to the nose. So, ibig sabihin, if this is the nose, if this is the forehead, we described it and anatomically, the forehead is superior to the nose. Okay? As simple as that. The opposite of superior is what we call the inferior or caudal. Uh, is defined as away from the head end or toward the lower part of a structure of the body or simply below. Okay? The navel is inferior to the breastbone. Okay? What else? The mouth is inferior to the nose. Okay? The eyes is inferior to the forehead. Okay? Lahat pababa or below. And that is the complete exact opposite of the superior. Okay? So at this point, okay pa tayo. We have the superior above and the inferior below. Okay? All right, next. Another anatomical term that I will be orienting you is this area. Anterior and posterior. Okay? Sama na natin mamaya si middle and lateral pala yung next. No? So, when we say anterior, it is also known as the ventral. Okay? It is toward or at the front of the body or simply in front of. Okay? Sa harap. When you say posterior or dorsal, it is toward or at the back side of the body. Behind. Okay? So, for example, look at this illustration. No, napakagandang tandaan ang anterior at posterior. In Tagalog, anterior sa harap, posterior sa likod. No? Front of, anterior, posterior naman is behind. So the breastbone is anterior to the spine. That's correct. Okay. What else? Posteriorly, if you want to describe an organ, the heart is posterior to the breastbone. So if this is the breastbone at ang gusto nyong i-describe is yung heart, so the heart is posterior to the breastbone. Okay. The spine naman is nasa likod. So if you want to describe the breastbone, which is here, the breastbone is anterior to the spine, which is nasa likod. Okay, so those are the different or the common directional terms that we use all throughout the anatomy and physiology journey for this set. Okay, again, anterior and posterior, superior and inferior. Now, let's go now to the next two terms. Okay, sorry, magkaiba na ng slide. So, next. Okay, let's go now to the medial and the lateral. Okay, so let's first discuss the medial. So when we say medial, this is toward or at the midline of the body. So papunta sa gitna. Okay? When you say lateral, lateral naman is away from the midline or papunta sa labas or palabas. That's the medial and lateral. So example of medial, the heart, okay, the heart is medial to the arm. So if this is the arm, papunta sa gitna, heart is always on the middle or the midline. So the heart is medial to the arm. Okay, let's discuss the lateral. So the arms are lateral to the chest because chest area is nasa middle. When we are describing lateral, lateral is papunta sa side. So the arms here, example, the arms are lateral to the chest. So kung saan papunta, okay, sabihin natin, the arms, okay, nasa gilid siya. So they are lateral to what's in the middle. Okay? So look at the illustration, no? Very good. Kasi yung arrow is papunta sa labas from the middle. So that is difference between medial and lateral. Next, terms are intermediate. So intermediate is between a more medial and a more lateral structure. So if you have an imaginary line at the middle, dito siya sa gitna. Now these are what we call your intermediate level. Okay? The armpit is intermediate between the breastbone and the shoulder. So Doc, saan po ba yung breastbone dito? This is the shoulder. breastbone and shoulder, intermediately is the armpit. Right? Right armpit, left armpit. So, usually yun lang naman yung isa sa mga structures that are described when we use intermediate term. Okay? Next. Okay. Proximal and distal. Okay? When you say proximal and distal, proximal, it is close to the origin of the body part or a point of attachment of a limb of the body trunk. So, ibig sabihin ng proximal, close to the origin. Okay? When you say distal, they are farther from the origin of a body part. So, let's give you an example. In Tagalog, proximal yung mas malapit, distal yung palayo. Okay? Look at this picture or illustration. The proximal is, for example, your hands are here. These are your distal part. And also your feet here, your distal part. So if you are describing papakyat towards the head, you're describing that at proximal in location. When you say distal in location, palabas or pa away from the origin. Now, if this is your origin, the head, no, away from the origin, that's your distal. Okay, so let's describe or give you some example. Proximal, the elbow here is proximal to the wrist. The meaning that the elbow is closer to the shoulder or attachment point. So if this is the shoulder or attachment point, our elbow is proximal to the wrist. So tama. If this is the origin, mas malapit si elbow kaysa sa wrist. That's why it is described as elbow is proximal to the wrist. Okay? Papunta, mas malapit sa origin. Distal naman is, for example, in the lower extremities, the knee is distal to the thigh. So, where is the knee? For example, in this picture, this is the knee, and this is the thigh. Okay. Now, if you want to describe the knee is distal to the thigh because the thigh is closest to this joint or point of origin. So if this is the point of origin and you will be describing the knee is distal to the thigh. Okay, that's great. So that's the difference between a proximal and distal. Let's go on to the difference between superficial and deep. So from the word itself, when we say superficial, it's toward or at the body surface. If you want to go deeper or away from the body surface, it's more internal, it is called deep. Okay, so what you see outside is superficial. If you want to go deeper or inside, it's called the deep. Okay, so example, the skin is superficial to the skeleton. Of course, because we see the underlying surface, which is the skin, and that is superficial to the bone. Right? What else? The lungs are deep to the rib cage. Now, this is the rib cage. No? And if you want to describe the lungs, which is inside the rib cage, the lungs, no? Yung lungs nasa loob ng rib cage, so the lungs are deep to the rib cage. So that is how you use the superficial and deep in when it comes to describing anatomical structure or function. Okay. All right. So okay, this is another slide. I've mentioned this, the superficial and deep. Oh, there is also this difference of an ipsilateral to contralateral. So by definition, it means on the same side kapag ipsilateral and contralateral is opposite side. So meaning left and right. So this one is ipsilateral. If this is involved, the right hand, the right leg is also involved, they're ipsilateral. But if the right hand is involved and the left leg is involved, they are contralateral to each other. They are on the opposite side. So contra, no, ibig sabihin different side or opposite side. Okay. Now, after describing the anatomical terms or the directional terms, let's go now to ordinary body movements. I will not be doing this, doing that, but this will be further discussed in the laboratory session. But I will introduce to you to some of the basic body movement, ordinary body movements. Okay, this is actually a very good introduction to some of you who are doing the gym, no, or strengthening exercises. These are actually more common sa inyo, but we will be introducing it to you as part of the introduction to anatomy and physiology. Okay, let's first describe flexion. Okay, flexion. This is a movement that forms an acute angle between an approximating body parts. Here, this is more common, flexion. Okay, you produce or form an acute angle. Extension naman, you form an obtuse angle between two parts. The angle now is increased and the joint is straightened. If this is the elbow joint, if I move it like this is flexion. If this angle is increased or the joint here is straightened, I am doing extension. Okay, flexion, extension. Okay. Well, what about rotation, Doc? When there is movement of the body part around its long axis, you are doing rotation. Most common yan ang head rotation. Okay, o kaya naman shoulder rotation. Okay, pwede pa yan paikot. No, and anything that when you move the body around its long axis, it's what you call your rotation. Okay, next, abduction and adduction. So ang lagi kong tinatandaan dito when you say abduction, when you say abduction, so ibig sabihin kinidnap or nilayo sa'yo. So by definition, the movement away from the midline of the body in the coronal plane. When you say adduction, is toward the body. So pag sabi kong abduction, kinidnap. So if this is my usually common dito abduction. Okay? Labas. Away from the midline. Pag pinunta ko sa coronal plane, adduction. Okay? Abduction, kinidnap, away. Circumduction is a combination of the two. Okay? So that's circumduction, abduction, and adduction terms. So please take note, flexion, extension, and rotation. Also abduction, adduction, and when you combine the two, it is called your circumduction. Yan. So mas maganda to pag nakita ka ng pictures. So this one is you're doing flexion. And if that saan yan? Yan. So flexion, knee flexion. Okay, flexion here. And also if that angle or if the joint here is straightened, in a straight mo yan, after a flexion, you are doing extension. Okay, this one is hyperextension, shoulder hyperextension. Rotation, as mentioned, it is in a long axis, so pwede ka mag-rotate. Of course, hindi yan papunta sa likod. Hindi yan pwede magkaroon ng 360-degree rotation. Okay, another rotation is the leg. No, if you move your leg from hip joint, you are doing a lateral rotation, palabas. But if you are doing a medial rotation, medial, papunta sa gitna, papunta yung movement ng rotation na yan sa middle, it is called medial rotation. Okay, and lateral rotation is palabas. Okay, also, another body movement is the head. Okay, look at this. Nasa gitna si head, right? If you want to have a head flexion is here. But if that from the head flexion, gusto mo siyang extend papunta sa normal position, that's only the extension. But if you want to do this, that is called hyperextension. Again, I'll do the side view. This is flexion, extension, hyperextension. Okay? So, habang inaaral ito, you also do some body locomotion. No? Mag-workout na rin kayo or stretching. Okay, next. These are just some of the special movements. We have protraction, to move forward, as in forward movement of the jaw. And retraction is moved backwards. So if this is our jaw protraction. Jaw retraction. Okay? Retraction and protraction. The jaw protraction usually mga ano yan, common sa mga nagkakaroon ng locked jaw. No? May mga excessive or nag-hyper-extend yung mga ano nila, yung jawline nila, nagkakaroon ng jaw protraction. But usually, na-retract yan. Pag hindi na-retract, no, go to the ER. For sila na yung sila na yung magko-correct ng locked jaw nyo. Elevation and depression, this is self-explanatory. So when you say elevation is to raise a body part and depression is to lower a body part. What about supination and pronation? Lateral rotation of the forearm from pronated position, palm faces anteriorly. So this one is the anatomical position, right? Pag supine, no? Supine is gaganon ka. Okay? Pronation, the palm faces posterior. This is the anatomical position, right? Pag this one is the pronation, this one is supination. Okay? Again, anatomical position, pronation. And if you want to go back to the anatomical position, it says here, lateral rotation of the forearm and the palm faces anteriorly from the pronation position. Babaliktad ninyo, no? The palms now is facing anteriorly. That is supination. Okay? These are movements in the forearm and there are responsible muscles for it. This will be later lecture to you in the muscular system. Next, inversion and eversion. Most common yan sa mga ankle sprain. No? The movement of the foot or the sole faces in the medial direction or inward. Okay? So this one is the sole of your foot. Pag nagkaroon ka ng ankle sprain, pag ganon. Kapag dumating siya or nag-face siya medially, that is inversion. If ever naman nag-landing ka ng pag ganito o may nakatapak sa'yo, gumanon ang foot mo, the lateral direction or outward yung sole of your feet, the term there is eversion or ankle eversion or foot or ankle inversion. The most common ankle injury is actually your inversion. Usually 95% inversion ang ankle sprain injury. No? Konti lang yung eversion. Okay, so let's proceed now to some of the body landmarks. Introduction lang naman ito. No? But in the laboratory part or session, this will be studied intensively. Okay? But in this introduction, I'll show you the other parts of the anatomy. But these are actually just body landmarks. So we have anterior and posterior. Yeah, anterior and posterior. So let's start with the anterior. And anteriorly, you may see here are the following: your nasal, your oral, so your oral cavity, sa mouth, cervical, sa may leg area, orbital, of course, eyes, and buccal is sa may cheeks area. Okay, buccal. What else? Sternal. Sternal here. Axillary is the armpit. The thoracic is the anterior chest. The brachial here are the arm. Antecubital is the one that we, when you are having a blood extraction, that is what you call your antecubital. Abdominal area are their abs. No? Those are seen at the anteriorly. Umbilical area. Yan, yung mga umbilical cord, where yung nakot na umbilical cord, that's the umbilical area. Pelvic area. Carpal area. No? Diyan yung common na carpal tunnel. If you are having or experiencing difficulty in flexing your fingers, usually your problem is a carpal tunnel. So that is your carpal area. Digital are your fingertips, or sorry, your fingers. No, there are term for that. Your phalanges. Those are your digits or digitals. Your coxal, your inguinal area, or in Tagalog, you're seeing it. Your pubic area here. Your scrotal area for men, Your femoral area is your thigh. Your patella is your knees. Your crural or your leg, anterior leg, and your tarsal are your tarsal area or tarsal bones. That's anterior area. Okay. Fibula. The fibula or the fibular are actually in the lateral leg. Yeah, lateral leg. But not just purely anteriorly. Now you may actually also see some of the muscles posteriorly. Okay. How about posteriorly? So we have the cephalic area. Cephalic area, not just posterior. That when you say cephalic area, the whole cephalic or cranial area. But to be specific, this is the occipital area. Occipital area talaga nasa posterior yan or nasa backside. Deltoids, your deltoid area, the scapula, yung butterfly sa likod ninyo. Okay, scapular. The vertebral column, vertebral. Ang spine is always at the posterior side. These are your lumbar area, your sacral area or sacrum, your glutes or your gluteal, your pec. These are found posteriorly. The femoral as well. The popliteal fossa is the opposite of your patellar area. Okay, if this is the patella, this is the popliteal area, and there's sural area or your posterior leg muscles. Okay, that's what we call your sural area. Okay. Right, let's go now to the different body cavities. So, as you all know, we know already what do you mean by dorsal and ventral. No? When we say dorsal, it is at the back side. When you say ventral, it is on the front side. So, para din yan anterior and posterior. But we mas magandang pakinggan if it is in the dorsal cavity or ventral cavity. If we are referring to a cavity, we have to use the dorsal and the ventral cavity. Now, if this is the human body na naka-side, kitang-kita mo agad kung ano yung nasa harap at ano yung nasa likod, right? Now, for the dorsal cavity, body cavity here, we have number 1, your cranial cavity and your vertebral or spinal cavity. So, dalawa lang sa dorsal cavity. When we say ventral cavity, there are 3. These are number 1, the thoracic cavity, the abdominal cavity, and the pelvic cavity. Doc, ba't ba may mga cavity yan? No? This is to divide the organs found anteriorly. These are the abdominopelvic cavity. The abdominal and the pelvic cavity, there are organs here. There are organs in the abdomen. So, dapat yung nasa abdominal organs, hindi pwedeng pumunta sa pelvic cavity. No? Common yan yung loose or your hernia. The intestine coming from the abdominal cavity will go down here kasi meron doon defect. No? Merong defect dito sa may portion nila. So, may mga organ like mga intestine na pumupunta sa pelvic cavity, and the most common of which is your hernia or loose in Tagalog. Okay? The thoracic cavity here, no? Organs found in thoracic cavity, heart, lungs. That's the most common. Okay? All right, so let's go now to abdominopelvic quadrants. Now, if you notice, no, you'll just have to, medyo madali lang to, you'll just have to divide the abdominopelvic quadrants or your abdomen or in your pelvic organs into 4 quadrants. No? Hindi ko sasabihin kung ano yung 1, 2, 3, 4 dito, but lagyan nyo lang ng right side and left side. Right? So after the right and the left, tingnan nyo kung upper or lower. Kaya kadali. So upper quadrant. This is right side, right, lower quadrant. Kabilang side naman is the left upper quadrant. Sa babang side is the left lower quadrant. Ganyan kadali ang mga organs. Kaya if I will be describing where can you find appendix, right lower quadrant, where can you find the liver, right upper quadrant. So you'll just have to do the 4 quadrants or describing it. Where is the pain, sir, ma'am? The pain, doc, is in here. So ikaw na magsasabi, you have a pain on your left, lower quadrant, etc., etc. So the most common are the right lower quadrant. Bakit, doc? Because this is where your appendix is located. Okay, one of the common medical emergency, acute appendicitis, at the very classic yan. Sometimes the patient is presented with pain in the epigastric area here sa gitna. Tapos after 1 day, pupunta yan sa right lower quadrant. Magko-complain yan na sakit doc na right side, the lower side. So you suspect that this patient has acute appendicitis. Okay? Okay, after the 4 quadrants, you have 9 abdominopelvic regions. Now, in this area, you divide the abdomen and the pelvic area into 9 regions. So, dito ko muna sa gitna. This is the epigastric region, the umbilical region, kung saan yung umbilicus, and the hypogastric region. This is yung, in Tagalog, yung puson. Okay? Now, from the epigastric to umbilical to hypo, you just go to the right side or on the left side. Okay? So the right side or at the right or left yan, tabi ng epigastric is what we call your hypochondriac region. Okay, your hypochondriac region. It could be left or right, hypochondriac. Basta on the lateral of your epigastric area or your epigastric region is your hypochondriac region. No? Ikaw lang magsasabi kung left or right. Now, lateral, no? Ibig sabihin ng lateral, sa gitna kasi si umbilical region. Lateral to it is what we call your lumbar region, right and left lumbar region. And the hypogastric region, ang nasa middle, lateral to it are your iliac region, your right and the left iliac region. So, at this point, for example, if ever I will be showing you a picture with an indicator, an X, you'll have to identify that. So that is at left hypochondriac region, right lumbar region, left iliac region. So you'll have to memorize the 9, this one, the 9 abdominopelvic regions and the 4 abdominopelvic quadrants. Okay? It's actually easier to describe the pain in the abdomen if you know the quadrants and if you know the region. The most common in this abdominopelvic region to use it in the hospital is actually this one, your epigastric area or region. So sometimes your patient will be complaining because of too much coffee intake or soft drinks, or that patient is fond of eating spicy food or a smoker, for example. That patient will come in at the ER complaining of an epigastric pain. Oh, alam ko yun, epigastric pain. Dito yan sa gitna. No? Just below the sternal area. This is the sternal area. This is the xiphoid process. Diyan sa gitna yan. Diyan mismo ituturo ng pasyente, sakit doc ng epigastric area ko. So, right now, as a first-year medical laboratory science student, taking up anatomy and physiology, you can actually apply it now at home. Sabihin mo, ma'am, ang sakit ng epigastric area ko. O, di ba? Mukha ng matalino. Ano naman epigastric area? Dito, sakit. Ano gagawin ko? Etc. Okay, sabihin ng mami nyo, ang galing ng anak ko, alam niyo epigastric area. Hindi niya alam, yun lang pala alam nyo, no? Epigastric region. But you have to take note of all the 9 abdominopelvic regions and 4 abdominopelvic quadrants. Okay? Okay, let's move now to this area. Okay, these are the common abdominopelvic major organs. Liver, the lungs are not abdominopelvic major organs. No? As ano lang yan, para pinakita lang na these are part of the thoracic cavity. Now, this is the liver. If you notice, sabi natin, hatiin natin to doc sa 4. Yan. So, liver is usually found at the right upper quadrant. the spleen and the stomach. The spleen is found in the left upper quadrant, but the stomach is also at the left upper quadrant. Okay? Yung stomach, nakita nyo? Masakit. Masakit po yung left side ko, left upper is also in the stomach. But if there is large and small intestine, we can actually determine the small intestine. But look at the large intestine. Alam nyo kung saan quadrant, right? The large intestine here, after the small intestine, this is the ascending colon. Nasa bandang right, top, lower to right upper yan. Tama. This is the transverse colon. The descending colon, more of sa left side, left upper and left lower. And yan ang mga common abdominopelvic major organs. Okay? All right, and then for the last objective for this specific topic, the life processes. Now, when we say metabolism, this is the sum of all of the chemical processes that occur in the body. Responsiveness is the body's ability to detect and respond to its changes in its environment. And movement includes motion of the whole body, individual organs, single cells, every tiny organs inside the cell. We call that movement. No? Growth, differentiation, and reproduction is also part of its life process. Growth is an increase in body size. It may be due to an increase in the size of existing cells, number of cells, or the amount of material surrounding cells, or sometimes because of its hormones, because of your age. No, you grow older. Yan ang nangyayari, growth na yan. When you say differentiation, it is the process whereby unspecialized cells become specialized cells. So they are different. That's why there is what you call the term differentiation. Reproduction, on the other hand, is the formation of a new cells for growth, repair, or replacement, or the production of a new individual. Reproduction, that's why in your finals, you have your male and female reproductive system, and their main function is for production of a new individual. We will be talking about that as the SEM end. Okay, now, for us, no, anatomy and physiology is a normal structure, normal function. We are actually maintaining homeostasis. No? The movement of the blood in the blood vessels, the movement of our arms, upper bodies, lower extremities, the way we walk, the way we talk, they're all normal. That is, because we are in the homeostasis. We maintain relatively stable conditions. Now, what else? It ensures that the body's internal environment also remains constant despite changes inside and outside of the body. That is maintaining its balance. We call it homeostasis. Now, is there any possible scenario, Doc, that this homeostasis will become unstable? Yes. If you have trauma externally, if you have an infection internally, it will affect its homeostasis, and that will become you have an unstable patient already, or you are in unstable condition. Sometimes if you are unstable, you are in the critical condition, and that will eventually lead to death. Okay? Anything that is altered in homeostasis of a human body, it will it will result into death. Okay? So that means externally, kung may mga traumatic situation, accident, no, nabagok yung ulo, nasaksak, no, it disrupts the whole anatomy and physiology of the human body. So that will be avoided. Okay? All right. And that's the end of the part 1 of the lecture, Introduction to Anatomy and Physiology. Thank you.